This segment of CoastLife is sponsored by Beebe Healthcare.
CoastLife, sometimes when we get older, you move out of your parents' house, and the first time you get a little sick, you're like, what do I do? Is this an emergency situation? Is this a go see your doctor situation? Is this a walk-in situation? We don't always know, but you know who does? Dr. Luis Castro with Beebe Healthcare. Thank you for coming in today.
Thanks for having me. Pleasure.
Of course, we're so excited. So, first of all, introduce yourself to viewers a little bit about your experience and what you specialize in.
Sure. So I am family medicine with obstetrics trained. So I did a residency in family medicine with a sort of a subspecialty in obstetrics.
Yes, and I understand you're sort of at the level of expertise where you teach others too, right?
Right. So Beebe Healthcare just started a family medicine program, and so they asked me to help teach the residents the obstetrical part of the training.
Nice. So let's dive into some of the difference between the walk-in clinics and the emergency department. When should you pick which one?
You know, that's a really great question, so I'm really happy to answer that question. What I always think about walk-in care is think of it as acute primary care. So it's something that you would normally go see your doctor for, but maybe they're not available, maybe if you're from out of town visiting, and it's not really a life-threatening emergency, it's more just a acute problem, a minor injury, maybe a small fall, maybe a small cut, a rash, minor upper respiratory problems, ear infections, eye infections, upper respiratory stuff, bladder infections. We manage some simple fractures, simple lacerations, cuts, and things of that nature.
Yep.
Simple things.
Yeah, and I mean, it is summer, so the kids are going to be home, and there's probably a good chance you're going to see some falls at some point. So it's good to know that you guys are always there to take care of us. How many walk-in centers do you have?
Currently, Beebe has 4 walk-in centers in Sussex County. We're opening one in Milton soon.
Nice. And so what really does constitute an emergency? Because I think sometimes there are situations where we really don't know if we're up against an emergency. Should we head to the emergency department or not?
Right, very good point. It's not always crystal clear. The things we think about the real true emergencies would be a major trauma, right? A motor vehicle accident, a major fall with a severe fracture, severe bleeding, Head injuries are big ones. If you've had any kind of head injury, we're probably going to recommend you go to the emergency room. Chest pain, right? Possible heart attack, stroke-like symptoms, things of that nature. Anything that's going to require further evaluation. The walk-ins don't have blood testing, imaging like CAT scans or ultrasound, so those are things that belong in the ER.
Yeah. I guess another question for you is, at what point should people, maybe sometimes we're the first responder on a scene when it comes to certain medical events. When should you call an ambulance?
Same thing. I mean, if there's something that is just life-threatening, it's an emergency, you don't want to delay care. So coming to a walk-in or driving yourself to the ER will delay that care.
Yeah.
EMS on the scene can evaluate, treat you appropriately. They have medications, they have devices to monitor you, and they can stabilize you and get you to the hospital quicker.
So how many emergency departments do we have in Sussex County with Beebe?
Yeah, so Beebe has 2. The main one at the main hospital in Savannah Road, and we have South Coastal, which is in Millville.
Yeah. And so when people do kind of decide, all right, I need to see the walk-in clinic, I'm going to head there, some people feel and believe that maybe they're not getting the same level of quality care at a walk-in, but that's not necessarily true.
It definitely isn't. I come from a primary care background for 20 plus years, and I had sort of the same misperception, but now that I've been a walk-in provider for almost 4 years, I can tell you the quality of care is excellent. We have physicians, we have nurse practitioners and PAs, very experienced. They're very, very good, and we definitely put the patient first.
Yeah. So let's dive in a little bit more to your specialty as well. When patients come see you, what do they kind of come see you for?
Yeah, I mean, we basically, take care of almost any primary care issue, especially an acute issue. So we'll manage, as I mentioned, the minor injuries, falls, upper respiratory-like things, small fracture care, simple lacerations, things of that nature. We also do have limited prescription refills for chronic medications, no controlled substances. So we will bridge that gap when a patient is coming in and hasn't established with a new provider, has to wait to get a new appointment.
Yeah, okay, nice. So how should they go about booking an appointment to see you if they need to?
So, one of the nice things about the walk-ins is we do provide some online appointment scheduling. So that is an option. It's not required. I think a lot of patients think they have to make an online appointment. That's just sort of a pace-setting appointment for them. But they can make online appointments. They can call us if they need to, things of that nature.
Awesome. Yeah, I know I've filled out some of that paperwork ahead of time when you go to the walk-in.
And that's extremely helpful. It does expedite the whole process if you can do that.
Yes, I have been met with that before, where I'm like, I filled out the paperwork, and they're like, gold star for you.
Yes,
like,
we love people like that. Absolutely.
Awesome. Well, doctor, thank you so much for coming in and answering all our questions. I know we always have a lot for you guys with Beebe Healthcare because we always just have so many. I think sometimes for the average person, healthcare can be confusing, and we love that you guys are here to guide us through it and then also help us out when we need you.
Absolutely happy to do it.
Thank you. Well,
Thank you.
We've got some more CoastLife, some more fun to get to when we get back. You're not going to want to miss that, so stick around.